Thank you very much, and thank you for inviting me today. I don't have any financial disclosures, but I will say that the majority of the research that I'm going to present today, or the data, come from sports and athletics research, and so there's not a lot of surgical research. I think that's the kind of the point of this talk, really. So even though I realize that this is mostly a minimally invasive talk or session, meeting, really, I think that we can all agree that we're put in awkward positions no matter what we do during the time that we're in surgery. And through those awkward positions, we have a lot of issues with spine and muscle problems. And ultimately, those awkward positions are really due to the natures of physics, right? So we put a lot of load and force on our bodies, and then ultimately, those physics cause issues with our muscles and our spine. So, for example, the static load that we put results in increased lactate and cell breakdown, which then, of course, causes a lot of fatigue. Similarly, the torsion and compression and the stress that we put on our spines result in asymmetric inflammation and just overall wear and tear. And then even the repetitive motions over time cause a lot of proliferation of inflammation and ultimately just causes a lot of issues for us, right? So there's a lot of things that we can't really necessarily fix when it comes to just being in perfect posture all day in the operating room. So my job was to try to give us practical interventions that we can do outside of the operating room to promote musculoskeletal longevity. And I'd wanted to do it in a circa 1998 late night with David Letterman top 10 way. So let's go. Number 10, immerse in hydrotherapy. You've probably seen a lot of athletes just go immediately into an ice water bath right after a big game or match. That sounds like maybe the worst possible form of torture for me. I'd much rather it be a hot water bath myself. But as it turns out, if you contrast both ice water and hot water, studies show that this actually does increase the blood lactate concentration. Now, that in theory would then reduce inflammation and muscle soreness, but again, data are limited in the elite athletes, which I'm sure all of us are in this room here. Number 9 really goes without saying. It's doing aerobic exercise, right? Aerobic exercise helps us in so many aspects of physical health, but it also does increase your blood lactate concentration. So ideally, if possible, we would, in theory, do at least 3 times a week of aerobic exercise. But make sure that when you do it, you don't end up hurting yourself and causing your job to be harder like I did a couple years back. It was all during COVID. Number 8 is invest in appropriate nightwear. Don't worry, it's not about to get too terribly scandalous here. In fact, it's really going to get really nerdy instead. So a lot of us clench our jaws when we are under a lot of stress, right? And this actually does happen at nighttime in particular, which can ultimately lead to neck pain or even waking up with a headache. And studies have found that actually wearing a mouth guard at night does help TMJ symptoms. So if you're wanting to be as sexy as this guy over here, then go for it. Similarly, wrist splints can actually really improve the symptoms of carpal tunnel syndrome when worn at nighttime. So something to think about. So number 7 is take magnesium supplements. This is going all the way back to medical school when you remember that calcium binds to the sarcoplasmic reticula of muscles and therefore causes muscular contraction. But if you use magnesium, it then binds to those calcium channel receptors and therefore blocks calcium channel, allowing muscles to relax. So if you have low magnesium, which many of us actually do without even really realizing it, then you end up getting the inability to relax your muscles. Similarly, low magnesium results in low vitamin D levels, and again, that ends up resulting in muscle weakness. That said, there's a lot of magnesium supplements out there, and unfortunately, as we know, all supplements really aren't FDA approved, right? So which magnesium supplement is right for you? Well, sulfate is really the best for muscle recovery, but chloride is the easiest to find, and oxate is the easiest to digest. So if there's really not a good supplement or you're not really willing to take the risk, then you can always get your magnesium supplementation through the diet. Spinach is wealthy in magnesium, as are pumpkin seeds and a whole host of other good for you foods, including dark chocolate. But if you don't want to do it by way of the mouth, there's always Epsom salts and sitz baths. Number 6 should go without saying. Hydration is of utmost importance. We all know that if you're not hydrated, your blood viscosity increases and therefore reactive oxygen species increases as well. And therefore that leads to muscle breakdown, right? But let's be honest, probably most of us don't have a big issue with drinking water. The biggest issue is doing the other part that causes us to be dehydrated. And that's the caffeine that we drink in the morning, potentially the alcohol that we drink at night. And so really, if we want to stay hydrated, you got to choose water. Number 5, now it's getting into the fun stuff. Okay, this one I can definitely get on board with, extending your sleep duration. Obviously, sleep has a lot of restorative functions, including it removes toxic waste brain byproducts, so that's a good one for us. But on the alternative, if we're not sleeping very well, then that actually increases our inflammation and decreases immunity. And did you know that muscle regeneration actually goes by a circadian rhythm? So if we disrupt that circadian rhythm, then we're actually also disrupting our muscle degeneration. So sleep is of utmost importance to our actual skeletal health as well. So what is a good amount of sleep, right? Can we just take naps during the day? A lot of people talk about that 20-minute power nap. As it turns out, this study showed that nocturnal sleep and the duration of nocturnal sleep is actually more important than sleep hygiene and naps for muscle recovery. And 10 hours actually is better than 8 or 7 hours. I don't know that a lot of people in this room are going to be able to get 10 hours, but surely targeting 7 or 8 hours is best. Number 4, also another one I can get on board with, is getting routine massages. I mean, obviously this one seems simple as well, but it turns out that a study out of Harvard actually really wanted to prove this point and customized a robot that would massage the legs of little mice. And then once they took the muscles and put it under the microscopy, they saw that there was actually rapid clearing of neutrophils and cytokines in the massaged muscles versus the ones that weren't treated. So if it's good enough for the mice, it is good enough for me. So book your monthly massage. So have you ever noticed when we start residency, the intern picture always looks really upright and everybody's super excited about starting their job as a doctor. And then about 20 years later, this is what we look like. It's not actually just a function of age, although to some degree it is. The reason why this type of posture actually happens is over the course of our jobs, we're sitting at a computer like this, we're standing at an OR like this, and what happens is the pec muscles get a lot stronger, and the back and the core muscles get a lot weaker. And so over time, the body just kind of contours to where the weak muscles are. So if we actually target and strengthen our weak muscles, we actually can improve kyphosis as well as just our overall posture. So what I've been trying to do lately in the OR whenever I start to notice that my shoulders hurt or my neck is hurting is ask myself what Sean T asked me on T95, is your core tight? It doesn't really take Sean T or somebody, like a personal trainer to help with that. In fact, there's all kinds of YouTube videos that can give you instructions on how to do back strengthening and core strengthening. And you don't need a lot of equipment. You could easily just use bands or even just a mat on your floor to really work on that. It's really more about the consistency and getting those strengthening muscles under control. So what do Long, the world famous pianist that I'm sure everybody knows here in this room, Michael Phelps, and scamper the rodeo horse all have in common? Any guesses? Well, none of them would ever perform without warming up first, right? So why is it that when we're about to perform a long operation, we don't warm up with the appropriate things? Sure, we're looking at the imaging and we're thinking about all the steps of the procedure, but how many of us are actually stretching in, in preparation for the surgery itself? Did you know that if you do stretch, you actually can improve your spinal stenosis of your back? And if you stretch your hands and your wrists, you actually can improve any sort of carpal tunnel symptoms as well. And this might actually help us prevent ourselves from having to get spinal surgery or carpal tunnel surgery in the future. So I often will do a lot of these stretches while I'm at M&M or in morning conference. My partner, Dr. Jorge over here, can attest to that too. I wear scrubs, so it's not inappropriate, but I sit there and I just like stretch my legs, and it's very unprofessional, very non-Mayo, but it is important to do, and it actually helps me get through the operating day better. And finally, this one's obvious, take time off. I thought about putting a lot of data up to show you that elite athletes or athletes in general take time off to really recover. But at the end of the day, I thought, I can just tell you that my back never hurts when I'm getting a Pronto Pup at the Kansas State Fair with my kids. So ultimately, there are active and passive interventions that we can do to kind of help recover from the surgeries that we're doing in general. But then at the end of the day, if we want to prevent or even help promote our long-term issues with spinal stenosis, or I should say not promote, but you know what I mean. Ultimately, strengthening and stretching are the way to go. Thank you.